If you've ever wondered why lipedema fat looks and behaves so differently from regular body fat, the answer lies in what's actually happening at the microscopic level, and it's genuinely fascinating. When researchers look at lipedema tissue under a microscope, three things immediately stand out. First, the fat cells themselves are abnormally large. We call this adipocyte hypertrophy, and in lipedema patients, these cells are significantly bigger than normal, and they keep getting bigger as the disease progresses. What's strange is this enlargement shows up not just in the classic problem areas like the hips and thighs, but even in areas that look unaffected. The disease is clearly more systemic than it appears on the surface. Here's where it gets interesting though. In regular obesity, enlarged fat cells tend to die off and get surrounded by inflammatory immune cells in a pattern that looks almost like a tiny crown under the microscope. Lipedema fat cells, they largely don't do that. They stay structurally intact and continue producing a healthy protein called pyrrolipin 1. So these cells are big, but they're not dying the way obese fat cells do. The second major feature is scarring within the fat tissue itself. Collagen builds up between the cells, creating a kind of internal fibrosis that gets worse with each disease stage. This isn't happening throughout the whole body, it's confined to the affected areas, which tells us something targeted and specific is going on. Third, the immune response in lipedema is unusual. Fat tissue in obesity is typically flooded with pro-inflammatory immune cells, the kind that drive inflammation and metabolic damage. Lipedema tissue instead contains predominantly anti-inflammatory macrophages. The immune system is responding, but in a completely different way. On top of all this, the blood vessels in lipedema tissue show wall thickening and cellular overgrowth. Calcium crystals are frequently deposited inside the fat cells themselves, and there's evidence of both cell death and new cell regeneration happening simultaneously, suggesting the tissue is in a constant low-grade state of breakdown and attempted repair. The bottom line is this: lipedema isn't just excess fat. It's a distinct tissue disorder with its own microscopic fingerprint, one that looks nothing like obesity and behaves by its own rules entirely.